So now that we've finished our dental, we are going to go over some different things as far as teeth and go home stuff, things like that. With our teeth, I should kind of go over, we have, these are our incisors here, canines, our premolars. You have 1, 2, on the bottom you have 1, 2, 3, and 4. This is canine skull. 1, 2, 3, and 4. And then you have your premolars in the back. So you have 1 and 2 here, and then 1 and 2 on the bottom. But you're kind of going around here. So it's 1, 2, 3, and then 4 quadrants. This would be your first incisor here, 1, 2, and 3. This would be like 1 of 4, and as you go back here, this would be 2, and 3 and 4 quadrants. So like for here, you'd have 103. On the bottom on that same side would be like 303 on this side. So basically, those are your teeth. You have your palatal side, your lingual side, the buccal side of your teeth. And then as far as your instruments, you kind of have your different probes. These would be your hand scalers. You have your curettes. These you would use for under subgingival to get up, clean up underneath the gums. You have, would be your periodontal probe. That's how you kind of probe and see how deep your pockets are. They usually run like 5 millimeters. Cats are usually 1 to 3, and dogs are usually 3 to 5. And then you got your shepherd's hook, and that you can usually probe some of the little, see how deep the holes are. If you have anything that's like you have a fractured tooth or something, you can use that to probe in there. But when you're scaling teeth, you hand scaling, usually about a 45-degree angle, and you're kind of going down in a 1 stroke, straight down. So you're kind of scraping whatever underneath out from underneath, like your gingiva under here, to clean up there. Sometimes you'll have kind of recession, this bone here, so you have sometimes you'll have a furcation, some of that bone loss. You just want to get up there and kind of clean it up as much as possible underneath there. You can also use those to scale in your crown to your teeth also. Some of the different instruments, we have the pack here. These are our elevators, which they kind of look like this, and they come in different sizes and different shapes. The smaller ones, this one's kind of a little bigger one, and that you use kind of the loosen up the kind of the tissue and everything, the ligaments and stuff, so it's able to extract those teeth. And we have the 2 different dental pliers here. These are parallel. So this one here, as you can see, there's kind of a space between 2. This is the one we use for dental tartar, just to kind of crack that tartar off. And then these ones have the 2. They're close together, so this is the one we kind of use to help pull. When we have that loose tooth, we can pull that out. We have our dental pack. This is kind of what we use to sew up the gums once we've extracted those teeth. But a lot of times when you're looking, you want to make sure that you don't have any fractured teeth, any like oral nasal fissulas, and that's usually when it's connecting from where your tooth was, kind of up into that sinus cavity, so you can kind of, sometimes you'll see discharge from the nose. Worn teeth, that can happen with chewing on really hard stuff, especially like tennis balls. You can kind of see with these here with the canines, you'll see that the back of those are worn, and the bottom they're like a perfect circle in that area just from chewing on balls, like tennis balls and stuff. Retained teeth, a lot of times it'll be these canines. You'll see there'd be on the top, they're usually behind, and on the bottom they're usually next to them. Those are the big ones that you'll usually see, especially in little dogs. They can cause problems with the adult teeth, so we want to get those out as soon as we can, just because it can cause a lot of problems with the adult teeth, the bone structure and everything around there, just because food and stuff gets trapped up in those, between those teeth. We want to, and a lot of times you might see like tooth root abscesses. A lot of times you'll see, especially with these big upper fourth premolars, they'll present with a kind of a bump right here under the eye, and a lot of times you'll see it's kind of already had ruptured, so it's kind of draining onto the face. That usually is something that we usually have to extract because they've abscessed, and that's the reason, one of the reasons why we do a lot of X-rays, because with dental X-rays, because you really can't see what's going on unless you take that X-ray, because then you can see the roots and the bone structure and see what's going on under the gum, because you really can't see that. They can, a lot of times they can look perfect and have great gums and whatnot, great teeth, and underneath there's like no bone holding those teeth in. So basically, so I have my, this is the sheet that we take care of. We usually chart when we're doing our dentals, so it kind of shows you here. This is where we can chart if there's any issues, like missing teeth, broken teeth, and this one there, he did have a little hypo enamel on that third incisor on that left side. So it's something we just kind of keep watch on that tooth, as he comes in. We have physicals, just check him over and things like that, and make sure that tooth is doing okay. As far as going home, take home stuff, we want to just kind of go over the importance of home care, and as far as brushing teeth, dental chews, anything, things to chew on. There are different diets that we can use. I know Hills has a TD diet. Eukanuba has a dental diet. Some of them out there. Good ones about, especially like the Hills one, it's that big one. When they chew on it, it doesn't break. So it's kind of like a brushing effect on those teeth. So that's a good thing to do. Just kind of stress about brushing teeth. The best thing to do is kind of like I said, the best thing to do is, if we perfect would be like 3 times a day. But we know that a lot of our clients don't have that kind of time. Great, once a day, but as much as you can to brush those teeth, and you just kind of go over brushing teeth. There's different kits. Some of them come with like finger brushes or toothbrushes. So it's, and you really want to focus on these big teeth, like the canine and these premolars. That's usually where, because that's where the salivary glands are, and that's usually a lot where the tartar or clanet will collect. So it's, you're brushing those teeth, and with toothpaste you want to make sure that it is a pet toothpaste, because fluoride can upset their stomach. It's in human toothpaste, and it's that enzyme in it, so it's really sticky. So once you get it in the mouth, it works really well. As far as like dental chews, we have the vet chews, and these will work great with, especially when a client is complaining about bad breath, because it does have a mouthwash in it. So it helps with that, but it also helps with the chewing action and helps clean those teeth a little bit too. They do have the dental chew greenies out there that help with that too. There's a bunch of other different treats. We like these ones the best because they do help with the breath itself. We want to and a lot of times we'll send home like a little kit, a little sheet that kind of goes over everything that we've done, and what they should do at home, how to care for those teeth. So hopefully they'll last a little longer. They won't have to come in as often, but it just kind of depends on the dog. A lot of dogs have, we don't have as good dental hygiene as other dogs, so we do have some dogs that come in every 6 months. Some of them come in once a year, every couple of years, and it just kind of depends on how they're taken care of at home. The better you take care of that home care, you stress about that, the better it's going to work. So, like I said, this one, the striker that we did, his teeth cleaned up really well, and we discussed home care and dental chews and different foods, making sure we're brushing those teeth. So, but his teeth cleaned up really well. He didn't have any problems besides that one little tooth. They cleaned up really nice. His gums looked great, and talked with her later, and he's doing really well with his after the dental. But that's basically kind of what we do with cleaning the teeth and kind of home care and things like that.